morning, everybody. Thank you for joining us on our live Zoom session today. This is on the business of skin. My name is Danielle. I look after training here for MedFX in the UK, and we have my counterpart in Ireland, a wonderful lady called Anita, and she looks after all our training with BFM Holland. Training is something that we're super passionate about here at MedFX, and we want you guys to have the most comprehensive and the most interactive sessions. So if there is something that we don't offer that you want to see, then obviously please do get in touch with us. You can get in touch with us via training@medfx.co.uk. So now my little blurb is over. I'm going to pass over to the lady that's the most important. So Annette Matthews is one of our esteemed trainers. Annette owns the wonderful W Skin Clinic in Derbyshire. So Annette, if I hand over to you, can you tell us a little bit more about yourself and a little bit more about what's going to happen today?
Absolutely no problem. Unfortunately, my slides actually have myself in them. So I think the best thing for us to do is actually go over straight to the slides and we can make a start on that.
Perfect.
The first thing I would like to say is that Danielle is super important, as are the rest of the team at MedFX that's supporting you guys after as well. So I definitely would go back on that one. You have to excuse me, I've got a bit of a husky cough and a cold, so if my voice goes a little bit funny, then that's why. But yes, I've got some water, so it should be okay. Very, very excited to be here. So I'm just going to screen share right now, and then we can get that going because that's the next gremlin. Host disabled, participant screen sharing. So you may need to allow me access to do that, Danielle. You have a little more,
bear with me.
What we're going to be covering today is various types of skin concerns that you might be presented with. And also, for me, it's kind of great getting all these new skills and looking at gaining new skills. But then it's ultimately how you can actually then utilize them and get them out to your clients as well. So we're going to be talking about them as solutions as opposed to skin treatments. I'm going to be kind of covering various brands as well that I like to work with. If you don't already, then you can start to explore those over the MedFX catalogue. And I'm pretty sure Danielle will help you with that as well. So let me try again. Yes, let me do it now.
Lovely.
So if you can just feed back to me to make sure this is all viewable and play from the start. So you can see, just tell me if you can see my the business of skin, Annette Matthews, DHT.
Yeah, I can see all that, Annette.
Fantastic. That's good. So the gremlins have gone so far, touch wood. Okay, yes, so really excited to be here. A little bit about my background, about me, but before that, I just want to talk through what we're going to be covering today. To explore and understand functional skin, how to achieve this, quite a small amount of this, because that's a lot to get over in the next 30 to 40 minutes ultimately as well. I want to make it slightly interactive if we can. It's always difficult on these webinars, but you have the chat option and the Q&A section, which we will obviously be saving. If we can't get back to everybody, if we do have an influx of questions, then just, rest assured, I will get back to you. Danielle will forward them over to me, and we can obviously pop an email across so you've got all the answers to your questions as well. We've got quite a lot to get through. Understanding how to plan treatments, and also a big thing that I'm passionate about is integrating treatment plans. So it's great when you have these new skills that you want to obviously utilize and use, but how can you make that work with various skin conditions? Because that ultimately will help grow your business and obviously the results for your clients as well. The power of home care, I do feel this is massively underestimated in the industry. Not enough people utilize this, potentially because of understanding. I'm guilty of that. When I first started, there are so many products out there. I felt a little bit lost, didn't know where to direct and what for. So I'll talk about how I've created skin plans for my clients as well. Understanding how to treat, maintain results for ultimately the main solution that clients are looking for. So acne, pigmentation, rosacea and sensitive skin. Rosacea we need to be careful with because it is obviously a medically diagnosed condition, but we understand, and hopefully by the end of this we'll understand a little bit more in terms of how we can help clients with that in the early stages as well. And then of course general skin aging concerns, which is ultimately what brings a lot of people through our door as well, and where we can start with them and the sort of treatments we want to offer. By the end of this, I want you to be thinking about planning your career, maybe changes in your career, how you can add things, boost treatment options, and also your business alongside us here at MedFX. It's a very, very exciting time. I think I've mentioned the vast majority of products, but there are more, and we want you to tell us. So we've got a huge array of products. If there's things that you need help with, then do feed that back to Danielle or myself, and we're always up for ideas and things like that. And lastly, hopefully by the end of this, you're going to be feeling positive, and ready to build kind of new changes within your business as well. And I'm not sat here doing this because I know everything. Absolutely. This is a school day for me as well. That's why I want to make it interactive, so that you can kind of come to me, and that'll make me think about how I can do things a little bit better or optimize it as well. So I'm not here to kind of sit here on a silver pedestal, as it were, because I'm not, absolutely not. So always out of my comfort zone. I did a lot of these webinars, both for myself and my own company, and for MedFX and various companies throughout COVID. So I was kind of very, very rehearsed to them. So putting them together is always still nerve-wracking, but obviously I've got quite a lot of content that I can utilize and reuse in the right manner as well. So that's always good. That's just a nice little picture of me and my brother. Again, he's probably squeezing me or pinching me or doing something on that picture there I wasn't very happy about. But ultimately, that is pretty much the face that I pull most mornings before I have to do something like this, because I'm always out of my comfort zone. More often than not, at least once a week as well, when we have those nightmare clients that come in who have really, really high expectations, which again, we're going to talk about, because a lot of this, skin conditions, skin concerns, solutions that clients are looking for that they've had for a long time will take a long time to fix potentially as well. So we must get them on board with that from the off. But yeah, pretty much that's the face that I pull pre most webinar or things that make me nervous. 10 years this year. I think I maybe need to amend that because it's 11. No, it isn't. It's 10, isn't it? 2023. Yeah, it's 11 next year. So that's right. That's right. Ignore me. So when I first started at school, I wanted to be a journalist. I started dabbling a little bit of beauty. I then went on to dental nursing, became a mum in 2009. Started my university course for dentistry, so dental hygiene and dental therapy. That was 3 years at the University of Sheffield. Straight upon graduation, became super passionate about skin, because clients that were coming in, obviously, ultimately, they were looking for Botox and filler, which we're going to talk about today. They're your entry-level treatments that clients tend to want to come in for, but it's down to us as clinicians to really help them with other things that they can have that can help their concerns as well. Got a new house in 2017, which I was doing up for a fair while and still am and are. And I did my teacher training around about 2018. As Danielle kindly mentioned, my clinic I opened in 2019. I'm not there every day now. I have people in there that are doing the things that I did and do. And obviously I'm always looking to grow that as well. In my head, I always wanted 2 or 3, but having one is quite frankly very stressful. So I'll put that on hold for a little while. I'm doing some other stuff as well. Back to university when I went to do my master's in cosmetic medicine. Yes, I was absolutely insane in terms of doing that. I managed my postgrad diploma, but the MSc I am just putting on hold for a little while with a lot of stuff that I've got going on. But ultimately, the last year, probably 2, have been a little bit of a blur for me. But what I want to share with you guys is how I've obviously built my business and my skin clinic, because I kind of found that was a gap and a niche that was missing from my training, and I'm really passionate to get that across with the support of the guys at MedFX, because the amount of and the portfolio of products that they have to offer that we can then obviously pass on with results for our clients as well. And that's my mum and dad there that you can see. This is very relevant. I know obviously it kind of like why she got pictures of Rubble and foundations and everything that's going on. I ultimately address skin concerns, skin complaints from the foundation up. So that's why I put these slides in there, okay? So ultimately that's my house renovations that pretty much started from a 1920s house, totally stressful. During COVID, we had no builders that could come in, so that's Annette actually putting the roof on her own house at that point. But the reason I've left that's my daughter as well, she's 14 now, so a little bit older than that picture, far more scarier, is to get us thinking about setting the foundations from the start. And also, I like to get my hands dirty, get nitty gritty and get down in there to do things as well. So I'm all up for kind of reinventing the wheel in a certain way, which a lot of my clients, they at first they're a little bit, oh, well, I just want them to come in for this, but how I get them to think about things is very differently. And hopefully you'll be doing the same by the end of today. Also been on a bit of a weight loss journey myself as well. So I have in total now lost around about 11 stone, if I look back, not from those pictures, but I've got worse pictures. Yeah, again, that's foundation setting from a systemic point of view. And during all that little timeline that I showed you, I actually passed my motorbike test as well, because I'm just mental. I've clarified that over the last 3 to 4 years. I think it might be an early midlife crisis, but I like to get myself out of my comfort zone. So a little bit about me there for you guys. So boring bit, sorry about that. But the passion side of things came for me. My previous married name, my non-married name is Annette Smith. That's why it says that on there as well. I'm not an imposter. I was working in dentistry, so I graduated from the University of Sheffield, and clients were coming in to see me for their dental concerns, and I was living life, doing obviously everything I've been taught to do. But I started to see clients coming in with various skin lumps, bumps, complaints, concerns, and I had a bit of an interest in that ultimately. I did my Botox and filler course, like where most of us start. I do actually name that a Dr. Death course, because ultimately you do things over a course of a weekend and you're kind of left armed with a bag of stuff that you can potentially use on patients. And I'll put my hand up now and say, I don't feel confident and competent utilising these treatments. I didn't feel that I knew enough about skin. So that's when I started to explore a little bit around that. So my first 3 months of graduation, I spotted 2 squamous cell carcinomas in the mouth, which is obviously my job to do. There was also things that I was finding on patients' skin that I didn't know enough about. So I started to explore that as well. And that's what grew my passion ultimately, to think more about skin alongside. I'm going to be talking to you guys towards the end about an accreditation that you can all do and log on to do today as well. And Medifex are hopefully moving forward to support these guys. And it's a skin cancer charity. So I'll talk about that towards the end, because we are seeing patients in this skin setting. It's really, really important that we know the early signs and what to spot and what to look out for as well. It also may help our diagnosis, obviously, in terms of skin aging and the things that are happening, because we'll be able to look at habits and why these things have occurred that we may need to refer on and get a little bit of help with as well. So as well as the 3 squamous cell carcinomas, I've lost count now, but I think there's 4 or 5 melanomas that I've spotted, both in a dental or a skin setting. But also, hundreds of basal cell carcinomas, which are very, very common, unfortunately, now. But that has given me the confidence to do that. But that's where my passion for skin came from. And then obviously my clinic has kind of grown from that side of things as well. In addition to that, I used to actually have my own skin concerns. You can see on the picture to the left, your left, my left. Goodness knows what it does when it flips these screens around. But I had really bad melasma, hormonal induced melasma. And it does still flare up now, every now and again, but I understand it a little bit more and how I can help with that as well, with the skin treatments that I offer. I had some acne scarring, so I did used to suffer quite badly with acne, predominantly when I was more overweight and my skin wasn't looked after. I wasn't looked after. That's when I used to find I had more skin concerns as well. And you just dry, dull, tired skin. So along with helping clients and obviously finding these people that are coming in that are looking for answers, I also wanted to help myself as well. And a lot of people that I speak to that get into the industry, that is ultimately their starting point. So starting with ourselves, a little self-experiment and see how we can get our skin looking and feeling better as well. And then my mum found that picture out with a bucket on the head. That is quite very much relevant, because at the time, that's how I felt like, I wasn't happy in my own skin. So things needed to change. And I always address, that with my clients as well. So from leaving university, I did around about 1.5 years of doing dentistry and just dabbling a little bit in skincare and learning a little bit more along the way. And then ultimately a couple of car crashes within 2 months. I took that as 2 signs to kind of take a step out from that 5-6 day a week clinic, 8 till 8. And that's when I started to then explore and think, okay, I want a bit more flexibility. I want my own space. That was my first clinic. It was actually in an office block, and it was next door to Dial-A-Rod. So I always make a joke about that. Clients would come in and be like, oh, are you next door to Dial-A-Rod? Yes, that's the one. Yeah, just knock on, we'll be absolutely fine. Nice little sink set up next door and stuff. So I like to put this in there, because if you are at the beginning of your journey, you're just like, how am I even going to start this? Hopefully it will inspire you. We start at the beginning, start small, not so small. That wasn't small to me. That was my little haven. And lots and lots of clients then followed me from then on as well. So all a big learning curve for me along the way. That's my clinic now that you can see on the right. And what I also find, I don't know why I put this picture up, but it is funny. That was me again. And I just find that matches the artwork that I've got on the walls as well. So everything all kind of combines there. In relation to the journalism, which is something I've always wanted to do, I love obviously writing up case studies and various blogs and things like that as well. I know MedEffects and ShopBee have shared them in the past, but the majority of those are on my website, and it's a great way to upsell treatments to your client as well. So if you are comfortable writing things up, or you want to be inspired by something I've written up, I'll do like a post on acne and then kind of push forward some acne treatments and things like that, and obviously every other solution that you're thinking about. So hopefully that will get you thinking about marketing and things like that as well. Just a few pictures of my clinic so you can kind of picture it. You're more than welcome to follow it and have a little look at the results. It's been a bit quiet of late. I've got quite a bit of stuff going on, as you can see, and you've heard about this morning. But ultimately, you know, that's where you can actually see the nitty-gritty of the results and the treatments that I'm offering there at my clinic and how it all works. And that's just a run up too. So lovely little countryside venue in Wirksworth, Derbyshire. One thing I want you to do at the end of this webinar, and generally in life, even if you can at least once a day, is reflect on obviously where you are and how you want to move forward with things. I do like setting goals. I have a bit of a SWOT course that I was going to share with the guys at MedEffects that you guys can do. It's all free, and I've got a link towards that at the end, because it is good to set goals. It can feel overwhelming when you've got obviously these things in front of you and clients that you want to help. But ultimately, as you do with yourself, when you're obviously trying to grow a business, you need to fuel what's inside. So look after yourself, but also the same applies to the skin. So I use this analogy on my training. If you've been on my training courses, it wasn't mine. It was Shirley Nichols, one of our first trainers, who I used to work really closely with. You know, it's about putting everything inside the tank. If we relate that to skin, it's about putting everything inside that dermis that is required to allow it to function appropriately as well. So every single skin condition or skin concern is down to this tank not functioning properly. So ultimately, that's why I said right at the beginning, and I had those random slides about building a house, it is about setting the foundations and setting things right from the off. If you don't do that, no matter what treatment you apply to it, the results aren't going to be as optimal as you want them to be. And obviously doing this is also always going to increase longevity and things as well. So anatomy of skin. So just so I can kind of see, I think you can all raise hands in this as well. Mm-hmm. Has anybody done any extra skin training or anything like that? Or has it all been predominantly Botox and filler and obviously treatment? If you put a show of hands up, then I can see. You can raise your hand on the chat, I think there. Just
so everyone's raising their hands. Lovely. What have we got? 1, 2, 3, 4, 5, 6. Let's have a look. 7. Yeah, everyone's coming in with the
okay. Well, that's really good, because ultimately, you know, again, you probably found as well when you were doing that at that point, I did it and I started to explore the skin more, because I kind of felt like I'd done my Botox and filler courses and I didn't really understand what I was, you know, I knew what I was doing with that product, but then I was like, okay, I need to know a little bit more about the skin as to how I can help with things other than that. In addition to that, my clinic, when I first opened it, believe it or not, I had what would you call protesters outside about using sausage poison and botulinum toxin. So I had to actually educate the little village that I worked in as well as to the fact that I'm here to help condition the skin. And yes, I do offer those treatments. They are super safe and great to use. And obviously it's every individual's choice if that's the treatment that they want to go for. But I also have lots of options as well. So over at MedEffects, we're working on a skin science course that you can potentially add to, and then that will be talking through more skin conditions and how you can address them. There's lots and lots of things that apply to that. Hopefully we know this already from a systemic point of view with our medical backgrounds. That is the way that we think about things, hopefully already. So your in-depth medical history, client history, all of that, once you've potentially utilize something like the skin science course or additional skin training, you'll start thinking outside the box as to where and why you can get results a little bit better by thinking from a systemic point of view as well. This is my Stella. She's a bit bigger than this now, but believe it or not, this is my French bulldog, and she actually has a skin condition. So of course she does. They are prone to having skin concerns, but my Stella has been through the mill, bless her, over the last 3 or 4 months. We're finally on top of it. Both the vet and I have worked together, and my mum, she's helped a lot as well when I'm away with work and stuff, and we are on top of it. But the in terms of the treatment, I didn't argue with the vet. I wouldn't do that. We went in and we debated her treatment plan. So I'm not saying that I'm now a dog dermatologist at all, but obviously my knowledge of what I have has certainly helped with Stella's condition as well. But from lines and wrinkles, we can really start to look at total skin solutions with a whole array of products that you can potentially access via MedFX as well. The solutions to sell. So this is where, when I did a new training course, I got really excited about chemical peeling. I got really excited about things that I can offer to my clients. And I'd put out there that I can now do these amazing treatments, even microneedling, radio frequency, chemical peels. Clients, they were scared off by that. And I can't remember who it was that actually said to me at the time, but they were like, I don't think I'd be booking in for that. That sounds pretty scary. So I started to flip how I did my marketing, and I started to offer solutions as opposed to, treatment options. Also talking through those solutions, obviously creating treatment plans. The way I do things in my clinic now, client comes in to see me for initial consultation, always really try and implement home care at that point for at least 28 days. So skin cell turnover, full cycle, get them using home care, no matter what condition it is or solution it is that they're looking for. It's not everybody's cup of tea, but the analogy that I use is the dental one. You wouldn't not brush your teeth twice a day until you come back and see us again for that checkup, okay? So I feel really strongly about that. And ultimately, in light of rosacea, sensitive skin, by implementing all skin conditions and solutions that they're looking for, by implementing twice a day intervention, that is always going to give us more pivotal results and optimize those professional treatments that we offer. So that's why we really need to have good quality home care that we can lean on. And there's various options that are available via MedFX. What I would suggest is you start to think about building kits for each skin concern that is potentially presenting to you. So there's various brands that you can obviously approach, or Danielle may be able to help you with that as well, because we have ultimately everything within that. The skin science course, we look at ingredients, we look at the certain things that you'd be thinking about for each condition. With acne, it's obviously salicylic or glycolic. Pigmentation, most definitely glycolic. Aging skin, again, glycolic is really good alongside amino acids and other treatments that you can implement there. Hyaluronic acid, definitely for aging skin and pigmentation as well. And HA and lipid restorative treatments and or home care for the likes of sensitive and rosaic skin as well, all at the same time as looking at from an intrinsic point of view how we can help. You can see the Sunnycross brand up there. They have their NutriCross drinkables. A lot of my clients that are coming in, I always like to get them on that, even just for a one hit, because it's quite a lot to be thinking about monthly. But once they get into that and they actually think about how they can offer these, how they can utilize these home care options, that they are fairly there. The skin plans that I offer, we look at them from that initial consultation stage. They'll come in with their concern. We'll produce a 3-month skin plan in terms of home care and treatments, initial bit of a payment up front, and then they can spread the cost as well. There are various things that you can utilize that will allow your clinic or your person and business to do that as well. So it's another way that you can really help, because it is, a lot of these treatments and things that they're looking for, potentially what can put them on hold is affordability as well. So that's why if you have various skin products and packages that you can offer, you can obviously open that up to more clients potentially as well. Another solution to think about there that isn't on that list is male skin. So, target your marketing on male skin for a month and just see what comes through, because we are all guilty of it. I do it when I'm putting slides together, when I'm talking, when I'm doing my social media posts. It's predominantly a picture of a woman or, somebody having treatment as well. So really think about that. And I think there's a picture in my slides a little bit later on about dealing with teen acne and acne, prepubescent acne and things like that as well. When I first opened my clinic, I used to have Tuesday evening, because that's when I used to work my late nights. the local school, I'd obviously put little adverts out in there, and if parents wanted to bring their teen children that were suffering with skin, I just taught them through little home changes that they can make, sell them like the basic in terms of home care package, and really get them on the right route and things like that as well. So education when you're upselling treatments is key, because that will really help your clients as well. It's difficult not to kind of get into it. I get really passionate and start talking about more stuff than that they need to understand, but then that reassures to them that they're in good hands as well along the way. So the skin is an extremely complex organ. Those of you that have done more education around it will obviously know, appreciate and understand that as well. We don't always get it right, so a lot of the time, like with anything, sometimes it gets much worse before it gets better. When we think about implementing peels and home care, we've all had those clients that come in and they predominantly say, I can't use anything on my skin other than soap and water. If I do, I get a reaction, I get a flare up, my skin is really sensitive. But let's think about the pH. So if all they've ever used on their skin is soap and water, that's way too alkaline for where we want the pH of the skin to be. So that's ultimately where I start. So you understand that soap sits around about 7 or 8, water 7.5 or 8 in terms of the pH scale. Our skin should be 4.5 to 5.5, or 4.75 to 5.75. So when you start to implement a routine, yes, naturally, we are going to have that initial reaction. So managing expectations and really educating them to the fact that, look, we're resetting the system almost, starting from the foundations. Once we've got that right from the top down, we can start to explore what we're going to do from the inside as well, be that injectables, collagen therapeutic treatments like microneedling, all of which I'm going to touch on for you guys today along this morning. Okay, so a few brands that I work with predominantly, but I do have other products that I use within my clinic as well. Sunnycos, absolute game changer for my clinic. Both clients that have had Botox and filler treatments with me in the past will all kind of, shout up from the rooftops once they've implemented something like a Sunnycos skin booster alongside. They start to notice their results are lasting much better. They're much happier with their results, because that is really going to help fix the foundations of the skin. So those of you who don't know, just a brief outline, Sunnycos contains amino acids. They are the building blocks of cells. We know this when we go to the gym. We're looking at building protein, building muscle. In relation to the skin, we want amino acids that are going to feed our collagen fibers, our elastin fibers, and ultimately a fibroblast. That's all in Sunnycos. So you do the math. In terms of from a science and innovation perspective, they have everything that's going on in there in order to promote and produce new collagen, new elastin. So it prevents aging, and it's also going to help reverse the signs of aging as well. We do have regular courses running for Sunnycos, which I'll obviously, there's a bit of a slide at the end, but I'll leave that one in Danielle's hand for you, because they're ongoing. If you've done your previous Sunnycos training, we do have our Performer, which is now on board, which is a fantastic product as well. We also have our Sunnycos Body. Remember that 10 stone that I said I lost, nearly 11? If it wasn't for Sunnycos and Sunnycos Body, I'd have a few more issues now as well. So I live and breathe that product, why I'm so passionate about it. Luminescence, that's one of the newer ones there from CMed Aesthetics, and their BioRepeal as well that they have, which is, it helps multiple skin concerns and provides various solutions for different things, to include rosaic and sensitive skin. I've used this on my clients with caution, and obviously when you're confident and happy to, it's certainly a product that you can utilize in many ways to really help multiple skin conditions as well. Luminescence, absolute go-to for pigmentation, and they have a little home care kit alongside that as well. So these are all things that if you don't offer them already, you can think about offering. And I'm going to talk through various skin conditions shortly, so you can kind of put a bit of perspective behind the brands as well. Starting with the foundations again, that's why I put that up there. So a little bit, oh, hang on, where are they? Oh, there's no slides on there. Can you see the words after that? I can't. No, neither can I. So I've got to try and remember all of these. So ultimately, in fact, let me just grab my iPad because they're on there. I don't know why that's not come up on here. So what I wrote is just a bullet point of various career options that you can bring in if you haven't got them already. Just bear with me one moment.
No worries.
It's on here, because you never know when this is going to happen.
It wouldn't be alive without one gremlin or two.
Well, I mean, I think we touch wood, we were doing okay so far. I just can't remember that many bullet points on a Tuesday morning. Where is it? Bear with.
Okay.
There it is, there it is. Okay, so your career, your journey, you've got skin analysis to think about, which you should all be doing when that client's first coming in. And potentially the skin, the skin science course could potentially help with that for you as well. If not, then obviously exploring a little bit more around skin. Nutrition is a big one, I find, with certain skin conditions. Obviously rosacea, psoriasis, eczema, all inflammatory conditions. So if you obviously try and get on top of that systemic inflammation, what may be going on, alongside hormones. So when I did my postgrad diploma, I was blown away with the effect that hormones has on the skin. So you've got obviously prepubescent, pre and postmenopausal. I have a clinic that I run sometimes down in Brighton at a friend's fabulous dental health spa. The likes of transgender people that are taking supplements and hormones and things like that will all have detriment to their skin health as well. So there's a whole array of things that you can really think to explore. Skincare, home care, and just regular facials, they're your entry-level treatments. Dermaplaning in particular is fantastic at getting the patients through the door, alongside skincare and education for them as well. Think about open evenings and things that you can maybe offer in your clinic to help utilise that. You are potentially going to see more skin concerns from summer into fall as well, and then fall into winter, autumn. So summer into autumn, autumn into winter, because obviously the environmental aggressors change ultimately as well. Biorevitalization. So I'm finding a lot of clients are now coming in looking for more biological solutions, that they're not always wanting the Botox and filler options, even though that's all that they understand, because that's where the marketing lies predominantly, which we need to try and change. Chemical peels, if you don't offer them, dermal filler, potential if you do already, Botox, microneedling, dermaplaning, semi-permanent makeup. I've seen other people go off into that as well to complement the likes of lips. So we have our lip master classes that we run, and we're going to be doing mid-face master classes and lower face and things like that as well. So you need to talk to us and tell us the sort of things that you're looking for. Plasma treatment, so fibroblast therapy, and then I've had a few people that have then gone on to do laser hair removal, laser skin treatments as well, ultimately, your PRF, PRP treatments. And then from a systemic point of view, once we know and understand a little bit more around nutrition, depending on your background, you can certainly start to look at vitamin infusions. That's something I'm not that confident with. I would always obviously explore that alongside their GP, but that's all about sitting where you feel confident in terms of your remit and your competency as well. So some of these treatments I would define as what we'll call the bread and butter. So I think an email went out yesterday. So again, let's revert back to when I did my Dr. Death course, had these treatments that I could do, amazing. Obviously overheads are quite small because you're obviously buying the product, you can charge potentially a good amount to get that revenue back. But they're only coming every 6, 9, sometimes every 12 months for these treatment. So I really started to think, I can't run a business like that. I know some people do and they do it really well. But you've got to have that regular flow of new clients coming in. For me, it was about getting somebody in more frequently. And how could I do that? So that's why I started with the skin plan, with the home care, and ultimately the 3 treatments that I would say, or 2 to 3 treatments that I would say are the main bread and butters for my clinic are microneedling, dermaplaning, chemical peels, my radio frequency as well for regular facials and or just regular home care intervention, reviewing them, seeing how things are going, and doing those regular treatment intervals. So in my clinic, my regular clients, I now see every 4 to 6 weeks once I've got on top of any sort of acute concerns that they have. So with new skills, or with the skills that you potentially already have, you can certainly look to apply that bread and butter aspect to it, because they're the ones that are going to be coming in routinely. And that has certainly worked for my clinic. So if you don't already offer them, you definitely need to think about exploring them to provide those solutions to your client along the way. So acne, pigmentation, aging skin, rosacea, and sensitive skin. They're the things that I predominantly kind of push out there in terms of marketing. When they're looking, you know, I tend to not word it as acne. I'll do blogs for, you know, open pores. If you actually go onto Google, you'll be able to look at the top hashtags for like this month, ultimately, in terms of skin concerns as well. So you have blocked pores, open pores, you know, clients will report oily skin. So if you start to then market towards that, if you don't have someone doing your social media marketing, that's all that they're doing at the end of the day. What is it that your client's looking for? And what I would suggest is just picking one of those niches for a little while and focusing on it. If you focus on one of these things, and I'll talk you through products to help with that, then you can also see how that can grow your clinic as well. So you can kind of be not a specialist, but you know, that's your niche. That's what you want to really help treat. My favorite thing to treat is general skin aging. I love obviously making changes there, but that starts with obviously home care. I always take a before and after for home care as well, so they can see the difference in 28 days that their application twice a day has made. It's not all the onus is on me. You're getting them to actually you know, contribute to their skin health as well. I love treating rosacea sensitive skin. So where my clinic is based, again, that's another thing to think about is demographics. It's in a predominantly like a farmer's area, so a lot of people working outside, quite poor skin regimen as well. So I see a lot of cases like this that I definitely want to help with. I've successfully treated rosacea clients that have suffered for many years with sensitive rosaic skin, combining chemical peels. Yes, I do peel the skin once we've obviously got on top of it with home care, and the skin booster Sunny-Cos as well, because that will ultimately help with that inflammatory response that's going on underneath the skin. Pigmentation, I will address with the luminescence or the bio repeal, and potentially some Sunny-Cos as well, because again, that's going to help with the inflammatory aspect because of the HA that is in that. Aging skin, the same. Acne, acute focus is normally on peels. So all my acne clients, unless they have allergens, I will treat with 4 to 6 bio-repeal sessions 1 week apart, okay? And we will then start to along with home care, we'll start to slowly slow down the amount of bacteria that's being produced, skin quality will improve, pores will tighten, oil will start to slow down production. We stop them doing all the bad habits. We talk to them about home care and education. There is a blog on my website which talks them through that as well, so I always direct them to that. You're not having to repeat yourself then, because it can become frustrating when you're seeing this day in, day out. So it's all about ways of, you know, utilising your time as well. So personal development is super important. Obviously, you're sat here on this webinar this morning, which is great. You might be watching this on a replay. Hopefully, you're enjoying yourself with a glass of wine if it's after 6. Have a plan. That's the best way to do it. So, as I said, think about certain. You know, you'll have certain skin concerns that you'll really want to get your teeth into. I do. You know, when I feel like I need a bit of a challenge, I'll put some marketing out there to get them in. Or if I have some new products that I start to read about, learn, understand more, do some training, I think I really want to do some case studies for that, then that's exactly what you can do. So you put your model call out for some certain case studies and obviously utilize these treatments confidently until you can then really, you know, friends and family ideally, but if you've got clients, like I have clients that are more than happy and they trust my judgment on that as well. Building that brand is important. My branding's all over. Someone told me the other day, like, what's going on now? What's this colour here? And why is that there? I'm not the best at it. Same as I say, that's not why I'm sat here. But ultimately building that brand, building that niche, you know, clients come to me because they have skin concerns. I can't always help them. If I can't, I obviously have people that I can refer on to alongside as well. So working together with other businesses is key alongside this as well. And then investing in those new skills and allowing both your treatment options, the solutions that you provide, and ultimately yourself and your own mindset, like doing the same thing day in, day out. I've been there, I've done that. It's quite demoralizing. So actually investing in new skills and then understanding how you can utilize and grow them That's what we are passionate about now here at Medifex. We always were. We've got a key team in place that can help with that as well. Remember, as I've said about the little blogs that you can put out there for your patients, knowledge will empower both you and your patient. So by understanding their skin concerns more, you can kind of advise them why that's happening and how that's happening, and why and how they can prevent that from getting worse, both with professional treatments for you to provide, but also home care as well. A typical journey of my client, like I've mentioned already: initial consultation, home care for 28 days. They usually can't get in with me for about a month anyway, because I'm over here, there and everywhere. And what we tend to do is do a plan for the year, which sounds a lot, but if they have an acute concern or something that's been going on for a long time, that is obviously blown up into an acute concern, it's not going to be a quick fix. Even, yes, we can really enhance facial features with fillers now, and obviously we can utilize Botox to really help, lift out lines and wrinkles as well. But if we're not fixing the foundations and the initial what's going on underneath, then the longevity of that is always going to be decreased. And I've done various case studies to test that theory, and it's true. So really getting them on board with the foundations at the initial stage will help you as your business to obviously grow, because you're seeing them more regularly, but it will also help optimize their results, which is key for your befores and afters. So we have prescription treatments, which we talked about. You understand Botox, you understand filler treatments that we can offer, and that's great. So fillers at the moment isn't a prescription item, but we do need a prescription item in the case of, obviously, reversal, and nobody should be doing these sort of treatments. You know this already if they haven't got access to that. These are sort of things that clients will potentially be looking for results for. The wording is slightly different. So remember, if you want to focus on an area, if you feel like doing more lip enhancement, you want to be more confident in that, then obviously we have our lip masterclass course, lower face, mid face medleys that we're going to be putting together for you, utilizing predominantly the Restylane portfolio. That's a product that I would love to work with. There are other options obviously available. It's about getting you confident with treating these areas. My advice to any client that's coming in for Botox, for filler, for any treatments like this: let's set the foundations, home care, skin booster, few peels, and then we're going to go on with this. It will always improve the results, from my professional opinion, along the way. Okay, we know what Botox will help do. We understand that hopefully already, because that's why we're offering it within our clinics. Again, for me, I look at this client, this patient here. She wanted Botox, that's fine, that's what we did. It helped with the static lines that you can see there, but her skin quality was always top of my agenda. You can see that she's obviously got quite large pores, and I've had multiple clients that have come to me, new clients, that all they've ever had is Botox and potentially filler, and their skin quality is quite poor. So I will potentially do that initial treatment for them, but then try and nurse them into thinking differently and having treatments that are going to help with their actual skin, because that will only enhance the results of the toxin along the way. So we went on to do some chemical peels, microneedling, to really help with the pore, complexion, and just general skin tone for this lady as well. She then went from having Botox every 3 or 4 months to 6 monthly, because she felt that it was the skin was more hydrated, the lines didn't come back as quick, and ultimately, the results were optimized for her. So we understand what dermal fillers are. They're a cross-linked HA. They're going to help firm the skin, enhance facial contours. We can help define the lip, and we have multiple, courses that we're going to be running moving forward through Medifex. But if there's anything that you want to learn more or know a little bit more around, then obviously do drop Danielle or myself a message, and we'll make sure that we can, embrace that and make sure that we're offering you what it is that you need in terms of treatment options. I obviously, treat head and neck and certain body treatments occasionally in terms of Sunnycross Body and Cell. One of my favourite things to do is lip regeneration, alongside obviously restorative and cosmetic dentistry as well. So that's what I love to do alongside skin concerns as well. You can really help clients that have suffered with areas around their oral commissures. They might get continual fungal issues going on because of the folds in their skin there, and just refreshing really subtly. That's the sort of work that I love to do. We're all different. There are multiple treatments that we can offer that are obviously prescription free as well. and we can certainly help clients with various concerns. You've already heard me talk about chemical peeling. My go-to peel is bio repeal. I also do have a place for the Sunnycos glycolic peel. I think that's pretty fantastic for pigmentation and alongside aging skin as well. So we will be offering and have chemical peeling training options that are going to be available very soon for you guys, if not already, not to put pressure on Danielle. As I mentioned already, my go-to for acne concerns is BioRepeal, and home care, of course, as well. So I always get them on a glycolic-based wash. Something hyaluronic acid induced as well to restore that hydration, work on the pores, that's what the peel will do as well. Obviously protecting the skin by applying like dermal corrective skincare and SPF that is really going to help prevent any further damage being done to that skin when we're peeling alongside. I get to see this lovely lady on Sunday actually at a wedding. I haven't seen her for ages, but her skin change was, she came to me for dermaplaning because a friend had booked in, and when she took her makeup off, I was like, okay. And they're the sort of things that I love to do. I'm really passionate about helping clients for, because it changed her life. She later went on traveling around Australia, which she told me she would never have done if she'd not got the confidence from her skin and the treatment that she'd had. So I mentioned teen prepubescent acne as well. There are various types of acne that can occur, and it's really important that we understand that in detail, which is obviously why that extra skin training is super important. A lot of my teen clients, girls in particular, obviously greasy hair, they're seeing changes during puberty as well. They may be washing the hair more often. What are they washing the hair with? I always explore that, making sure it's SLS free, paraben free, and minimal chemicals, because that's all going to have an effect on their skin when obviously it's already breached as well. Good home care regimen, good lifestyle changes, again, education to mum, dad, and the patient potentially as well. But the teenagers, they don't always listen. I've got one; she doesn't either.
I can concur on that.
Yeah, they go to Primark and buy these masks that are full of absolute naffness, and they're putting it on their skin. So just getting them on board with that and getting them on an affordable, regular skin routine as well. Dermaplaning, we can offer that physical exfoliation, complement a facial or a peel. One of my biggest sellers at my clinic is dermaplaning in conjunction with BioRepeal. So I have clients that come in every 4 to 6 weeks for something like that. I like to obviously alternate, so they'll have that, but maybe then next session have radio frequency, next one after that microneedling, but regular intervention and collagen therapeutic treatments. Dermaplaning, I set up a little gig with a local makeup artist as well. So if anyone was having any sort of big event that was coming up, they then potentially come and condition their skin before, because I've seen it where they're putting lots and lots of contour and makeup on. Take that makeup off, their skin is very poor underneath, but it's a vicious cycle once we start with that. So education as well for those sort of clients with their concerns. But a great starting point, like I said already, that entry-level treatment that they're going to come in for, and get them onto professional skincare. It's going to penetrate much better by doing the dermaplaning alongside. Any peel is going to penetrate better, their home care is going to penetrate better, and they're going to feel like there's more going into and around the skin. Biostimulation as well, that's super important. That's intrinsic, extrinsic approach, how they can obviously systemically make a difference. So I've got the next slide, I think, is talking that one in a moment, a couple of books that I recommend you guys to read on nutrition and the skin and the effects that actually has. Ultimately, it's huge. There's another lady who works in the dental sector, Juliet Reeves. She's done a master's in nutrition, so I lean on her quite a lot when I have quite complex cases as well. So that's another avenue that you can potentially take your clinic down if you are seeing patients with continual concerns. You really need to explore nutrition and how that can help, definitely. From a biostimulative point of view, Sunnycos for me is a go-to. It helps with inflammation, it helps with various skin concerns. I've treated acne scars with Sunnycos. It's the ultimate skin booster that is there to help put all the foundations back in the skin, like I've said right from the beginning. It helps rejuvenate collagen, elastin production, and new fibroblasts even at the 6-month mark. There is no other product out there that I've found that does exactly that. So I can lean on that confidently as well. couple of types of Sunnycos available, and then we now have our body and cell. But when you understand the technology behind the amino acids and the HA, and a bit more about the company, which I'm really passionate about when I do the training for these guys, they're a medical-based company, and their bag is tissue regeneration. So ultimately, they've kind of shifted that from a medical perspective onto aesthetics. They don't just have an aesthetics company, which when I'm looking for evidence-based products, that's exactly where I'm at. And yeah, their products are incredible, with incredible results as well. So microneedling, we are going to be offering microneedling training with the One Need pen, and we also have the CMed range, which is that's on the next couple of slides. Well, I'm forgetting where I'm at. But microneedling is a great adjunct to your clinic if you're not offering it already. You can treat acute conditions. So someone might present with hair loss, with acne scarring, with general scarring, general skin concerns, large open pores. All of those things you can address with something like microneedling. You need to obviously put in the right ingredients on and needling that in. That's important. And I can help with that as well. And that's something that we'll be covering on the training for you. So full face regeneration, as you can see, by integrating these treatments together. So this lady on the bottom left, she came to me, dull tied skin. She thinks she wanted filler. She thought she wanted X, Y, and Z. So I said, let's start with the basics. What's your skin regimen? Exactly what I've walked you through all morning today. Good quality skincare, and of course, of Sunnycos and chemical peels. And then we probably do every 4 to 6 weeks microneedling now, and you can see the distinctive difference. Same for the lady in the middle, and same for the lady on the end. She's contemplating a little bit of oral commissure filler now. Obviously, we can see and potentially the perioral area to help lift there. But she's really pleased with her results, and obviously a bit of Sunnycos for that neck area as well. Fantastic results. Pigmentation, again, pre and post menopausal, we may see this more. A lot of pigmented skin, the damage was done a long time ago, but education is still key to prevent that from getting worse. Alongside chemical peels, I like to complement it again with Sunnycos. For its anti-inflammatory powers, what it will help do is control any post-inflammatory hyperpigmentation from experience as well. So we're putting something in there that's going to work alongside and help calm that melanocyte down that might be a little bit overexcited and producing too much pigment, which is obviously then decreasing our results as well. So microneedling that I mentioned, and I talked about treating men and focusing treatments around men. If they have patchy beards, understanding a bit more about the hair follicle and hair regrowth, that'll all be part of potentially the hair microneedling course that we're launching very soon as well. And we have our Aries range, which is made by the guys who make BioRepeel. So you can actually needle this into the skin, into the hair, into the scalp, and improve their hair regrowth, as you can see here. Got some good pictures of clients from the front as well. Just had a gentleman come back to me, so I'm just building his pictures back up again. It's been 1.5 years and he's only just starting to see or feel the difference again, so we're going to be readdressing with another course of treatment alongside some home care as well. Plasma skin tightening, that's something that you can offer if you don't already in your clinic as well. Fabulous alongside Sunnycos. So anyone that's booking in for plasma with me will have Sunnycos first. 6 to 8 weeks later, I'll then go on to the plasma skin tightening procedure as well. So we put the fuel in there, and then we're going to obviously get it a little bit excited by doing these burns in these areas to help tighten the skin. Plasma skin tightening is also known as fibroblast therapy as well. So by putting the fuel in there initially with Sunnycos, you're inducing that fibroblast response alongside doing this. That's what's going to give us more optimum results. We also have our PRP, PRF treatments and training that is available as well, which Danielle will be able to give you a little bit more information around. It's not a treatment that I currently offer. It's something that I've always wanted to dip my toe into. But again, I found my niche and the treatments that I love to do so far. So that's exactly what I'm doing. But I understand, and I've read lots of good stuff around this treatment, and would definitely, recommend adding it to your remit eventually. So recommendations in terms of that book, this is a great little book that you can get it off Amazon, the Healthy Skin Diet. So if I have clients that are really suffering with their skin concerns, they've come to see me, we're starting to see a bit of leeway and things are starting to get better. We've got them thinking about antioxidants in their diet and their skincare regimen. Inflammatory skin conditions in particular, by implementing a healthy skin diet, that's where you will see changes. Pre-post menopausal and prepubescent acne as well. I find if we explore this alongside and they make small changes, then that will always exacerbate our results as well a little bit quicker. So thinking about things like that, if you're getting your client in for that initial consultation, if you're building these kits or these packs up for them, could you include that in there for them to think about? That's going to optimize your results for them as well. That's what we did with Elise here. We looked at diet, lifestyle. She used to go to the gym a lot, which is great. But then she'd be traveling home for like 30 minutes from the gym, not washed her face, all these little things, talking about lifestyle that make a difference, as well as thinking about anti-inflammatory foods that she can really get in and power in there to improve. I'm really, really passionate about integrating treatments together in order to get the results. So this lady top left, again, she's another case of, I just want some filler, a little bit of Botox. Let's think about this differently. Let's restore. She did have a little bit of mid-face filler, but predominantly it was skin hydration, home care, good quality skincare, regular intervention, budget dependent. And the last thing that I did was a little bit of mid-face filler. You put in cross-linked hyaluronic acid in an environment that's already depleted of it. So why would you not want to induce that first with home care, skin treatments, and the likes of Sunnycross skin boosters as well? Okay, same applies for this lady. She wanted nice, subtle changes. Naturally, she wanted nasolabial filler. I didn't agree to that in the first instance. We went on with our Sunnycross. We did some microneedling, some chemical peels. Finally, place a small amount within that fossa there to give us that final lift. She also had, I didn't actually put this picture in, she got a dog bite near her eye as well, and we helped address that with microneedling and Sunnycross. So understanding the treatments that you offer and how you can integrate them will always give you better results as well. This lady is actually 69. So she's looking rather fabulous. And yeah, I love Barbara. She's one of my regular clients as well. She'd had obviously treatments elsewhere. And she came to me having had filler, she'd had Botox. I just looked at her skin. I was like, right, okay, do you just let me do? Is that okay? Some clients do, some clients don't. This is my plan. This is what I want to do. She's an avid Sunnycross lover. She's always there on a model day. She loves microneedling as well for skin pore textures, and obviously upper lip, we've done some work with Sunnycross. No filler. She's not had any filler with me since I've been, in fact, no, that's a lie. We did do her jawline of late. That was before this picture as well. So integrating these treatments together and really getting them on board will help improve in the long term. So with new tools and skills, you can obviously, hopefully you've clarified by the end of this that you can optimize those solutions to your clients. With smart marketing as well, and thinking about what your clients are going to be looking for and how you can help them, that's how you can help build your clinic as well. Reviews, Google reviews, really, really important. Making sure that you obviously, your clients are reporting back to you, so you can share that with others when they're happy for you to do that if they've left the review. That's really, really important as a business as well. You will get, I had my first negative one last week or the week before, and it was managing expectations of that patient. They wanted really immediate results. That's why when I see them for an initial consultation, I've talked about the home care, I talk about a 12-month plan. I actually write that up for them. So I just have a template that I use and I say, look, you know what, these are your concerns. This is how I can help you. These are the products that I'm going to recommend. Obviously order via Medifex or wherever it is I'm getting these products from, treatments that I'm going to recommend, and we make a plan for them. So if they've had something for a long time and it's quite acute initially, and obviously it's been going on chronic and it's been causing lots of problems, it is going to take quite a while to resolute as well. And like I said right at the beginning, it sometimes gets worse before it gets better. So you can't make everybody happy, and don't be too hard on yourself, is my advice at that point. By implementing various treatments, obviously working within my remit, working alongside the guys at Medifex, and continually learning and adding these new skills, and treatments that we can potentially offer with their evidence as well. So what's great about Medifex is the products that they have there's always someone in the background looking at, is that actually effective? We see it on Instagram, Facebook every day, these new things that have come out, which are the next best thing since sliced bread. But when you're ordering products from places like Medifex, you can rest assured we've done a little bit digging around to make sure that they are going to do what we want them to do, so that we're not offering them to clients and then having an absolute nightmare with it afterwards. So safety in practice, make sure you're insured and competent, thinking about when we need a prescriber if we do. I know obviously we are medics only, but some of us are non-prescribers, so that's important that we understand that. Where to go to next? I'd love for you to come towards and tell us the sort of courses and things that we have planned. Something I'm really passionate about is cannula, especially in terms of the filler and even skin booster. So we've got our new cannula confidence course, which is being launched in the autumn as well, and that will really get those skills going from potential weekend filler options that you did, just like myself. And again, this is just a bit about the MASCAD accreditation that I mentioned right at the beginning. If you guys could give them a follow on Facebook or Instagram, have a little look on mascad.org, and just type that in and it'll bring up the accreditation that you can do. As a healthcare professional, you're going to do the MASCAD Pro. And that will arm you with lots and lots of tools to spot these early signs of potential skin cancer and melanomas that you can potentially help patients with as well, that you may see on a daily basis. And I even told someone in the supermarket the other day, this wasn't me, this was a colleague that I put forward for it. Her name is Sarah Breslin. She did and found a melanoma on a patient and saved their life ultimately as well. And that was from a day job, dental day job. And she ended up obviously saving this lady's life. So I am very passionate about MASCAD and getting that across to in any which way or form when I'm doing any sort of webinar. So we have online and face-to-face training options, which I'm sure Danielle will be able to tell a little bit more about. If you haven't seen it already, it's probably popped into your emails. You can probably scan that QR code now and it'll take you to it. All the courses that we have coming up that are available. In terms of the biorepeal, potentially we are going to be covering microneedling with biorepeal as well. It just depends who we have booked on their backgrounds. I think that's the way we can do it moving forward. But biorepeal you can utilise as a microneedling device, underneath the skin more for certain skin conditions. And certainly I like to focus my training on providing solutions and looking at the sort of things that clients might be looking for and how we can upskill you with that, not just saying here's a bottle of biorepeal, this is what you do. I want you to be thinking about how you can actually utilise it alongside skin concerns and solutions as well. I mentioned this swap plan and go. Obviously, all this can be a little bit overwhelming, like what she's been talking about for the last hour. If you want to message over to Danielle, then we can get you access to this course. It just helps you kind of put things together. I used to hate doing SWOT analysis. I used to actually roll my eyes at any thought of doing anything like that. By setting small targets, I promise you it will help. Like where you want to be in 3, 6, 9, 12 months' time, we can help with that as well. That's me and my little girl. So if anyone has any questions, please pop them into the chat or the Q&A for me. And just a little quote, like I always like to finish things on, just to keep us all happy and helpful and grateful. And yeah, that's me, finding solutions since 1986. Not just for skin, general life. Doing that, guys. But any questions, do let me know.
Annette, that was amazing. Thank you so much. So informative.
Hopefully
I'll have a
so.
little look. So no one's popped any questions in the chat just as yet, but I'm sure if they've hang on. No, I'm fibbing. Let's have a little look. Oh, someone's asked if they can have a recording. Of course you can, Lucy. We can get that sorted for you. Everyone who has attended today, I can send a link across for the recording. And if you'd like to go to the Medifex website and have a look under the training tab, you'll see all the courses that we have available. Or you can email me training@medifex.co.uk. And obviously we can get you sent a net swap plan. And if you've got any questions, any queries, if I can't answer them, obviously Annette is best placed too. And anybody who would like to book a course between now and the end of September, I can offer you 10% off your course booking. So just, as I say, drop me a message, drop me an email, and we can have a little look at that. Just before you go in, I do have a couple of little questions. So Grania has asked any discounts. Yep, Grania, we can offer you 10% if you'd like to book with us. Victoria has asked about a plasma machine. Can we send the costing? Absolutely. We can have a little look at that for you. Yeah, we can. Yeah, definitely. We can look at everyone's queries, and yeah, I'll get around to you all. Annette, thank you for a wonderful session.
No problem at all. Thanks for having me.
No worries. Take care, guys. Enjoy the rest of your day.
Enjoy, guys. Thank
Bye
you.
bye
Take care.
bye.
Bye bye.